Will you stop going to health facility because of fear that you'll be diagnosed of the COVID-19? This is the perception some residents of Gbarnga and its environs have since the outbreak of the coronavirus pandemic in the country. These people are afraid that they will be tested for COVID-19 and will be quarantined. Mary, a resident of the Gbarnga Hill community, is 4-month-old pregnant. She has turned to drugstore instead of seeking proper medical care at a hospital.
I can go to the hospital, yeah. I still won't go. Then they can put me there. They will say I get coronavirus. Then they will hold me. They put me there. And me bad do nana. I won't go to the hospital. Then people go home. I just 4 months pregnant. Again, I can't go to the hospital. Me, mama can tell me say I should go to the hospital. In the morning time she will come, she say go to the hospital. So because I want no problem, when I say I'm going, she will say you go to the hospital, you be better. So I can go to the drugstore. The small money I can make, I can yap my small medicine. If be my hand in plaster, I bring it when she ask me. I say I come to the hospital. I know and I go back doing it because I don't want for them to say I get coronavirus. The coronavirus, but I getting serious.
Quita Flomo is a 2-month-old baby mother. She hasn't taken her child to the Phoebe Hospital for routine vaccination since the start of the 3rd wave of the virus. Quita said, I used to visit the hospital when I was pregnant and until I gave birth to my daughter, but got deeply afraid when information about the 3rd wave of the coronavirus broke out, thinking that my daughter and I could be tested for the virus and held in quarantine. I was afraid hearing about the death news of other people and thought that I would have been held in quarantine. Madam Sarah V is the chairlady of Medicaid Town, about 4.5 miles away from Gbarnga. She has turned to herbs as a source of medication because of fear she would be tested positive for COVID-19 at the hospital.
No matter what he used to write, then what tear running, so there your hair will fire, the blood will come from your nose. All that one they say when it's happening, then that is symptom. So we can be afraid. Then that will move our country leave and you say on us will be well. Yeah.
So the whole corona time you not go to the hospital?
No, because the fear will be there. We'll be thinking that maybe we'll go because that's the way they can talk about the injection and things, and we say the people get their medicine, they want to go put it in us. We start worrying only as somebody private.
Medical experts have warned against self-medication, which they say puts people at risk. But amid the misinformation that people are tested for COVID-19 once they go to the facilities, the county health official has refuted these claims. Dr. Jonathan Flomo is the county health officer of Bong. He said the information that people are tested for COVID upon going to the hospital is far from the truth. According to Dr. Flomo, health officials are not doing random COVID-19 tests, and COVID tests are done based on consent from the patients, their case history, and signs and symptoms presented by the patients.
In medicine, before we treat you for anything, we'll ask questions. That's the reason the doctor or the nurse will always ask you questions. What happened to you? What brought you to the hospital? Based on what brought you to the hospital and from the assessment of the health worker, that way we can even suggest that we think it is good that the signs and symptoms you're presenting, or with your travel history, where you came from somewhere where I have a lot of cases of COVID-19. That's the time people get involved into even testing. And with that, we also seek the consent to make sure that you understand the reason why you should be tested. And almost all of those who have been tested for COVID-19, they are people who agreed, who even some of them came and suggested, I think it will be good, you do the COVID test. So the COVID test is not for everybody. And before we do those things, we have thorough history taking and questions that we do to make sure that we can authenticate reasons why we are doing this. And the testing kit also, we have these testing kits, they are not just common tests to do. They are expensive. So they just don't want to use them randomly or anyhow. Let me say this to the people, that the hospital should be a first point of contact. Testing people for COVID-19 is not testing everyone. We'll take history, and if you fit in the case definition of COVID-19, then we tend to make sure that we can investigate so that we can be on the safe side. The health authority in the county, we want to admonish the citizen. I Our primary goal is to make sure the people of Bong County are healthy and can carry on their activities in very, very good health. Against that background, all of what we have been doing to test people, to isolate people, those are public health interventions that we do to make sure we can save majority of the population. As I said initially, in an outbreak, to control any disease, the first thing you want to do is to make sure you identify people with this condition. And to identify people having this condition, you have to do testing. That's where the testing really comes into being. And we just don't test, but we test based on history. What is signs and symptoms you're presenting with? Who all you go in contact with? We ask those questions to authenticate that you need to be tested or we are thinking of something different. And now everybody who presents the respiratory symptom we are done testing for. So what I admonish everyone, make the facility your first point of contact. We don't just treat anyone for COVID-19. COVID-19 treatment is difficult. To isolate people, it requires funding.
The decision by some people to avoid health facilities has seen drop in a number of patients seeking health care. At the CB Domba Maternity Hospital in Gbarnga, there is a sharp decline in the influx of patients since the outbreak of the coronavirus. According to Nyama Sibo and Gopu Na, two other screeners at the outpatient department of the hospital, they see an average of 17 patients a day. But before COVID, an average of 40 people were screened daily.
Patients not really flowing in the hospital anymore. We have less cases. We need to see about 30 to 40 patients for now. We may see sometimes 17, 18 because of the news that COVID has spread. If you go to the hospital with the diagnosis of COVID. They have two other screenings. If you compare it, some people have like 20, some people have 25. But if it's cold, it will be like 45. For this kind of cases have gone down. The two rooms only receive 17, 20 to 25.
We noticed that the whole of last month, the hospital was empty. Sometimes we come to work, we receive 2 patients, 3 patients, 5 patients, because people became afraid that if they come to the hospital, they are going to be tested for COVID. So they stay home. When they are sick, they go to the drugstore, buy their drugs, and take it.
For the SGBV department, the supervisor, Madam Musu Moba, says they get less than 5 cases a day.
For my unit, daily, I used to have around 5 cases a day. But now, 2, 3, now 1, now none.
The current situation appears to be a repeat of the 2014 Ebola epidemic, when many people showed low confidence in the health system due to the widespread of misinformation. Some perceive the virus a death sentence. Bong County has recorded 120 confirmed cases of the coronavirus, out of which have been 10 deaths and 50 recoveries. Now, health workers are worried that the more people stay away from health facilities, the worse the situation becomes. They want people to take advantage of the facility rather than purchasing drugs when they do not know the status of their health.
During the Ebola crisis, I worked at the FB hospital, and then we had the same problem. And that was why we noticed that during the Ebola crisis, so many people died because of the same fear of coming to the hospital. My message to them is that they should keep calm. They should come to the hospital when they are sick. They shouldn't fear.
And I want to tell them out there, when you're sick, don't keep yourself in the house. Say when I go, they will say I get the COVID. They won't do nothing. They will only treat you. My message to them is that I beg you, when you're feeling a little bit sick, you got your headache, you got a cold, don't sit at home. Come to the hospital. We'll treat you. We'll advise you what to do next.
As health workers and authorities urge people to regain confidence in the health facilities, some already have. One is Copper Flomo, an employee of Cotton University. Flomo says going to hospitals is the best decision anyone should take.
I'm mostly interested in going to the clinic or hospital. And I am speaking I work with Cuttington or Agape. I go there if I'm not feeling fine. And also the terminal, all of those places, and most especially Phoebe. And I got car for all of the places. And I also extend it to my family whenever they are not feeling fine. I encourage them to go to the hospital. For me, I don't have that fear. Buying tablet in the street will not help you because you don't know actually what's the problem you're facing. So it's better to go to the hospital. But if you just have that fear, a drug that are not supposed to kill you or sickness that are not supposed to suppress you, it will suppress you.
Regaining confidence in the health system is essential, but curbing misinformation that undermines the credibility of healthcare facilities is even more essential, especially during public health crises. Solving this problem is terminating the root cause of a problem so detrimental to achieving a desired public health agenda. Reporting for Internews Inspires Project, my name is Emmanuel Ballah.